PrEP, or pre-exposure prophylaxis, I think is one of the really new findings that we really have been able to bring to the community at large. I think in the past people have assumed, and I have doctors that tell me all the time, well, there's nothing you can do for someone who has HIV, and there's nothing you can do to prevent people from getting HIV, and I think that's completely different. So really being able to offer patients one pill, one medication once a day that you can take to prevent you from getting HIV is a dramatic new availability that we really can look at across the United States. And there's new studies showing that it's very effective and that it's extremely usable by patients. I think one is education. I think so there's a risk that people don't understand really what how to use PrEP or when they can use PrEP. I think also there's a lot of education that needs to be done. There were some statistics that came out from the CDC at the end of last year that talked about 1 out of 3 doctors and physicians are not aware of what PrEP is. And I actually have patients that come to me all the time and say they talked to their primary care doctor, and their primary care doctor said there's nothing you can have to prevent yourself from getting HIV. And really that's an education process that we need to continue to do for physicians and make sure that primary care doctors, if it's OBGYN, family practice, internal medicine, or even pediatrics and adolescent medicine across the entire spectrum, really understand that there is something that you can do to prevent HIV. And if you're not familiar with how to do it as a provider, there certainly are providers in your area that can certainly help you with that. It's not difficult to prescribe PrEP. It's much like many other preventative strategies that we look at. So in primary care settings, we look at preventative strategies frequently, mammograms, colonoscopies, and other routine strategies. No one would think of seeing someone for an annual visit and not getting a hemoglobin A1C. So taking a look at preventing HIV as a modality is something we should really think about as part of a primary care encounter. I actually don't for the most part. I mean, I am seeing a little bit of those who are coming to me because they're interested. A lot of the patients that come to me have already seen one of my outreach staff in the community or have been connected to me from another provider. But those that are coming to me are very engaged, and one of the most common reasons patients are telling me they're interested in PrEP is that a lot of their friends are taking PrEP, a lot of their partners are taking PrEP, and they want to protect themselves like their partners are being protected. So I think we are seeing an uptake in it. We've seen dramatic changes in 2015 and 2016 based off of new data that's come out. So there's a lot more prescriptions that are being written. I think the key is we need to make sure that we're looking at medication adherence, and we're making sure that we're prescribing it in the right way, and that we're seeing patients on a frequent basis, and we're looking for other sexually transmitted infections along with the PrEP. I think what people thought is there was a lot of question about how we're looking at sexuality, and what I usually portray is a very sex-positive experience, and I think that people are basically taking protection into their own hands, and they're basically empowering themselves to be able to take care of their own health. I think initially people thought this was something that was being foisted upon the LGBT community or upon other sexual minorities, and that was something that was not well received, I think, by the LGBT community. What I'm trying to do, and what I think a lot of people are doing now, is saying this is an option that's out there. You can consider it as part of the toolkit, as part of the options that you have available to you. And just like some people may want to explore some options, other people may want to explore other options, this is something that's available for you to look at. PrEP is something that you can start and stop. It's a conversation that you should have with your provider about this. It's not something that you need to be on for the rest of your life. What I tend to discuss with my patients is why are you starting PrEP? And then I revisit that question, do you want to stay on PrEP, every time I see them, every 3 months. And that allows for an open conversation about what their sexual practices are and how risky their behaviors are and what we need to be doing to kind of help decrease their risk of acquiring HIV. Some people prefer to stay on PrEP when they're in a committed relationship. Some people don't. Some people have committed relationships but also have relationships outside of that. And so whatever someone's individual practices are is really what we talk about. It's a lot like if you're talking to a diabetic about diet. You're not going to give the same diet advice to every diabetic that walks into your office. You need to customize your insulin regimen, your medications that you're receiving, and the treatment, their nutritional advice based off of their personal behaviors. And so if you can figure out how to work with people about their own sexual preferences and their own sexual identity and orientation, then we can really target the needs of PrEP to that individual so that it best helps them achieve what they're looking for and can keep them as healthy as possible.